So, are you new at nurse faculty or being a clinical adjunct for a nursing program? If you are, and you will be taking your students out to clinicals, this video is for you. Okay, my name is Nurse Teri Davis, and welcome to my channel. I help new nurses, new grads, even nurse leaders or nurses who want to pursue entrepreneurship on their nursing journey. And today I'd like to discuss this video is really for the new clinical leaders, the new clinical instructors, adjuncts, nurse faculty who is entering their very first day at nursing clinical rotations. So let's get into it. All right, so my first time at being a nursing faculty, full-time nursing faculty, my first assignment was to take my students. I will be doing, well, I'm the pediatric instructor to a children's hospital for their clinicals. Never done it except for when I was in nursing school and working at a children's hospital. Just seeing the students around and speaking with their clinical instructor, this was my first time actually taking nursing students out. So I just want to give you some really quick tips. This is not going to be a long video. I really want to give you some really quick tips to win at being a nursing faculty, a nursing clinical instructor, okay? Rule number one is when you get, so usually I have my students meet me at the site at a designated area, and all the details are sent out in an email prior to my clinical rotation. All the details on parking, so make sure that you send out an email saying welcome to the clinical rotation, your expectation on what time they're to be there, where they need to meet, where they need to park, because sometimes if they park in the wrong location, they could get a citation or a fine or anything like that. So you want to make sure that they prevent that and definitely don't want to be towed. Okay, so I have my students arrive at 6:30. They park in a specific designated area and they are shuttled to the children's hospital. Okay, so once we get there, I do my meet and greet. I go around and introduce myself to the students, and I ask them to tell me about themselves, what their names are. You can do an icebreaker like a fun fact, or even like if they have any prior healthcare background, okay? Once you do that, I have a team of 8. I don't know how many you will have, but find out how many you will have. And also, let's go back. Before you actually get to the site, make sure you reach out to the nurse manager of that unit, introduce yourself, and let them know when you'll be coming, how many students you'll have, and see if there are any expectations that they have so that you won't be either non-compliant or just in a weird situation where you should have known something had you just reached out via email. All right, so I did that. We were very welcome. They were expecting us. And so, yeah, so back to the students and have them introduce themselves. And once that icebreaker is out of the way, you can get down to business, okay? So you want to let the students know what your expectations are for this clinical rotation. For me, I expect safety first. Do not perform anything or any nursing interventions unless you really understand what you're doing. If you don't know what you're doing, if you've never done it, let the nurse know that you have not done it and to either demonstrate it first or walk you through it. So safety is the main priority, keeping these patients safe, really introducing yourself to the patient and the families. I'm at a children's hospital, so letting the nursing students know that, hey, we are in a pediatric setting, the parents know the most about the patient. Talk to the patient's family, talk to the mom, talk to dad, find out what their baseline is. Okay, so safety first, making sure that my students know that I am available, that they need to feel very welcome at asking me anything. No question is a dumb question. Yeah, so when they're doing their clinical interventions, I want them to be very hands-on, but be very safe, so that if you're not sure about anything, please don't just act as if you know what you're doing and you don't. Ask your nurse to demonstrate it, or ask them to walk you through it, or ask me to walk you through it. Okay, and I expect for my students to be engaged the entire 12 hours. Be engaged with the patient and families, be engaged with your nurse that you are following, and as well as usually they get one nurse that they have to do their clinical care plan on, but I expect that they care for all of the patients that the nurse is assigned to, so that they get as much experience as possible. So they are experienced on their med passes, they are experienced on any clinical checkoffs that we've done in the lab simulation. And I am very adamant about ensuring that I, as well as they, tie in any lecture material that they've learned, any in that didactic, with the clinical setting. So I need to understand, are you connecting why we did something, what you did in the clinical setting, with why you did it, based on the learning that you've gotten in lecture, based on the exams, based on all of the didactic material that you have learned, so that we gel the two. Okay, that's very important. That is what I do pre-clinical rotation. So at 6:30, this is what we're discussing. Okay. And I took some notes. Okay, so during rotation, so that's pre-conference. That's what you call pre-conference. So safety first, um, professionalism, being very visible. Like, I don't need to be looking for you. Your nurse does not need to be looking for you. You need to be on the unit at all times, unless you have to use the bathroom, unless there's an emergency where you need to check your cell phone, whether you need to make calls, because we do still have families, people that rely on us. But I expect for my students to be engaged, to have a good rapport. I expect to see them interacting with their nurses at all time, asking questions, following them to the med room for med pass, doing NG insertions, I expect for them to do everything. Okay. I don't expect for them to stay on their phone, to be on their phones. I expect for them to leave the unit if they need to use their phones. I expect for them to communicate with the team respectfully, and to please let me know if there is a disconnect with the nurse. If the nurse is not wanting to have the students be there, or they're just giving them a cold shoulder or being rude, they need to let me know that immediately. Do not continue on your day this way, when this could have been rectified. Okay. Yeah, I do not expect perfection. I just expect curiosity, preparation, and engagement. Okay. All right. So once we get that out of the way, we go to the unit. I introduce myself to the nurse manager or the charge nurse. I assign my students to their patient. I give them the name, the room number, and who the nurse is, and I have them go find their nurse, introduce themselves, and get started with their day. They're so timid when I have them do this. They're like, I'm like, just ask around. The first person that you see, ask them who Sherry is. I'm assigned to nurse. I'm going to be with. I'm going to be working with Nurse Sherry today. Are you Nurse Sherry? Do you know where I can find her? Like, just go ahead and get out there, because they're just like, when I tell them, okay, now go find your nurse and let's get busy. They're just like, like it's not, it's easy, right? Okay, so during clinicals, I rotate. I'm walking around the unit at all times. I'm engaging with different patients. I'm asking my nurses, okay, why is your patient in the hospital? What concerns you about this patient? What are the abnormal findings that this patient has? Any weird, out of the norm labs? Are they scheduled for a procedure today? Are they planning on a procedure? A surgery is what I meant to say. Um, are they engaging? And I'm on pediatrics, so I like to ask them, like, do they seem like a normal 2 year old? Are they sitting up? Are they holding their head up? Or do they walk? Do they talk? Are they like what? Based on your um, based on what you know about 2 year olds, based on what you've learned in lecture about the milestones that a 2 year old should have met. Is this baby meeting these milestones, like based on your assessment? And then, like, what are your priorities with this kid? What's your nursing diagnosis? What intervention is important today? Like, is what intervention is critical right now? Okay, and then what questions did you ask the family, and what questions did the family have, and how are they coping? Are they even present? Right. So these questions can be asked in any setting, in any clinical setting, because social barriers will come up at, to plan for discharge. Like, is this baby here? Has the family even been here? Has the mom been here? Are the parents in jail? Are they adopted? Are they in the custody of the state? Like, a lot of different questions you need to be assessing, not just the clinical assessment, but also the social, any social barriers that may complicate a safe discharge. Okay. All right. So just for you, you just need to you need to be engaged. If your expectation for your students is to be engaged, you need to be engaged as well. You need to show them the confidence, because they look at you, and they pull off of your confidence, how confident they will be. Okay, so during the day we have these mini lessons, just small, just little talks, just little probes to kind of steer them in the direction that they need to go. And yeah, and even like based on the unit, what they'll see. So on a med-surg unit, you'll see diabetic patients, you'll see DK, patients that have been there. I mean, all types of patients, respiratory, circulatory, people with high blood pressure, um, diabetes, infection, pneumonia. So based on the unit that you're on, you need to tie in the norm for what they'll see. Those things that will. So I'm on right now. We're on a pediatric neurology unit, and so we see a lot of seizures, a lot of traumatic brain injury, a lot of car accidents that may have severed something in the brain or the spinal cord, where they have to do a lot of physical therapy. We see a lot of VP shunts, intracranial pressure, and fluid and things like that. A lot of headaches, a lot of seizures. So seizure precautions are very important on my unit. Yeah, so based on the unit that you'll be assigned to, or the specialty unit that you'll be assigned to, you need to customize your lessons, your midday discussions when you're walking the unit and interacting with your students to that specific specialty. Okay. All right. And so lastly is the end of the day post clinical conference. And really, I really just let them de-stress, debrief. So there's like a post clinical debriefing, which is at the end of the 12 hours. So this is around 6:30. I was sometimes usually about 6:15. That way I give each of the students time to talk about maybe a baby that was physically abused by the parents, to really get that out. And usually I'm trying to do that during the rotation, but at the end of the day, they like to get that out. And I like for them to get any difficult patients out, so that they don't take all of that home with them. So this, having them, let their nurses know that they're leaving for their post-clinical conference early on, so that they'll let their nurse know. I let the charge nurse know. I turn in my badge and everything, and thank the team. Yeah, so we talk about those difficult patients. We also talk about, I loop back in the specialty, and I hold a discussion about really tying in everything. Didactic, clinical practice, what you saw on the floor today, what surprised you, what shocked you, what were your what was your most challenging moment, right? What did you learn from that? And what, going forward, is there something that you may want to research about the situation? I also have each of the students do an SBAR. The situation, what was your patient's situation? What was their age, their diagnosis? What was the background? Their medical history? What was your assessment? What key findings and key factors played a role in what brought this patient to the hospital, why they're here? And then any recommendations? What's your nursing priorities? And really tying in their clinical judgment and their clinical communication skills. So that's really what this activity is really to build and enhance their clinical judgment and their communication skills. And then during that time, while they are talking, while each one of them are talking, I am doing their clinical evaluation forms. I do that at the end of clinicals. I sign it so that they can upload it and make sure that they get credit for it, that it's not lost, or that I have to take time out the next day during lecture to sign them, or to try to remember how they did or what I saw. So also going back to during clinicals, during the rotation, I'm actually taking notes on the situations that we're discussing individually, and I'm taking notes on how they handle them. I'm taking notes on how they communicate with their nurses. I'm taking notes on how engaged they are, and whether they're actually practicing their skills. So I'm taking notes. I'm walking around and I'm taking notes. And at the end of the conference, or during our discussion in the conference, I'm talking and communicating with them, but I'm also signing off on their clinical evaluation forms for the day. Okay? All right, so I think that this is gonna make you very successful at your first day of clinical rotation. Please do not be nervous. Just understand that you got this. they're gonna love you. You don't have to be perfect. You don't have to know the specialty to a T. You just need to bring your experience, bring your confidence, and be engaged with the students and with the staff. Also, I'd like to throw in a little tip. When you speak with the charge nurse, see if she has any connections in any other specialties like OR, pre-op, PICU, and ask her if she could reach out to that nurse manager to see if you could, maybe next clinical, you two students could go to that unit, so that your students have a variety of choices on where they do rotations, so that they can get that experience. I did that, and two of my students got to go to pre-op and OR and actually see some really cool procedures and really see how those nurses in those areas care for patients. And it's totally different because pre-op, they don't have for specific patients. They have patients that are coming in, they get them prepped, and then they go into surgery. And then the OR nurse is something totally different as well. So they're able to get some extra experience just by you taking ownership of that and really introducing yourself and asking based on your position. So that's all I have. Thank you for tuning in to Nurse Teri Davis. I hope this helped all of you new clinical instructors, adjunct clinical faculty, or clinical instructors. I appreciate you taking time out to view the video. Click the like button if you liked it, share, subscribe, and even place something in the comments and let me know whether it helped you or not. Thank you for tuning in again, and I'll be back with more videos. Until next time, bye.